Oxford from the inside. The good, the bad, but always the truth.
Hello and welcome back to Oxford from the inside. The good, the bad, but always the truth. I am your host, Junaid Hamid. I am a third year at Trinity College studying medicine, and I'm joined today with our guest, Ayman. Ayman, would you like to introduce yourself?
Hi, I'm Ayman. I'm a third year at Christchurch, and I'm also studying medicine with Junaid.
Indeed, he also studies medicine. We're in the same year, and we're here today, as you can see from the title of the episode, with a pretty big one. I'm pretty excited for this episode today because we've covered medicine in the past in our episodes that I've done and been interviewed on, with discussing the personal statement, discussing the interview process, and even comparing medicine in a traditional course like Oxford with a problem-based learning course. But we haven't actually done discussing what studying medicine is actually like at Oxford itself, a preclinical medicine, that is. I'll get into the details on why I specify that. But we haven't actually done that yet. So today, that's the aim of this episode. I'm looking forward to it. Ayman, are you looking forward to it?
I'm very excited for this, yes. My
Brilliant
podcast.
Yeah, here we go. Ayman's debut on Oxford from the inside. So yes, preclinical medicine. Why is it that I say preclinical medicine? Well, the Oxford medicine course, and is the structure for the traditional medicine courses, as we discussed in that previous episode, is split into 3 years of preclinical studies and then 3 years of clinical studies. So for today's episode, we'll be discussing the preclinical course, because of course we are third years, and that's all we know. But because we're third years, we have actually experienced, we're kind of, two terms into third year now, so we've experienced quite a lot of the preclinical course so far. So we're in a good place to talk about it, and that's what we're going to be doing. So jumping right in to actually talking about the structure, this was actually also a question that we got on our Instagram. With the course being split into preclinical and clinical, what are our thoughts on whether we feel like we're missing out on clinical studies in any way?
So I think that there is some element of, as a medical student, it would always be nice to be able to get into hospital. But I think the trade-off there is that when we do enter the hospital, hopefully we'll really know a lot about the diseases which we're seeing and what we're looking at. And we definitely do get some clinical exposure. So some colleges have tutorials up at the hospital. So I used to have pathology tutorials at the JR itself. And we also have GP contact. So you have a few sessions through your first and second year where you get to go and see patients. And some students, for their intercalated degree, I think not this year because of COVID, but in some years have actually worked with patients as part of their research project. So there definitely is scope to get clinical exposure. And so this trade-off is that when we actually go into the hospital, we get to spend so much more time in the hospital. And I'm really looking forward to that personally.
Yeah, I'd agree. I think like my idea when I was applying, I applied to medicine with the idea that I definitely wanted to be a doctor. Like that's what I want to do. And even now, like I'm very, like you just said, Ayman, I'm very much looking forward to those 3 years of doing that. But yeah, like you're saying, I saw it as I wanted to get the opportunity to like properly cover the core like scientific content behind the medicine first before I started practicing it. So I could sort of mentally, for me, it sort of made sense to divide it into theory and then practice, so I could make sure that I've covered all the theory. That was sort of my thinking. I don't know, Ayman, if you sort of felt the same way.
Yeah, I think it was partly that for me. And I think the other thing is I knew that I wouldn't, during these 3 years, or I didn't feel like I would lose sight of what was the end goal of actually being a doctor and working with patients. And I think if you worry about losing that, then it isn't necessarily the right medical school for you. But if you think you can kind of get through it, and you can do those 3 years without lots of patient contact and keep your eye on the prize, then it definitely can be the right place. And also, there's so much going on that I think it's kind of a relief we don't have to be going up to the hospital right now, because you're so busy in the first 3 years that it's nice to not have that extra kind of burden yet and not be in a hospital not knowing what you're doing. Whereas hopefully when we do go, we will have a bit more idea of what's going on. We'll be able to appreciate it a bit more fully.
Yeah, I think that's a really good point that you made about how busy the first 3 years are, and how you do have that degree of sort of self-motivation that is required, because I think even I've heard lecturers say or tutors say at Oxford that the first 3 years train you to be a scientist, the second 3 years train you to be a doctor. So you do definitely need to remember that, being a doctor is coming, that teaching's coming, but you've got to stick through. So it's a good point to go into now, how those years are sort of divided up. We've got the first, actually, Ayman just mentioned just a while ago, the intercalated degree. So just going into explaining what that is. The first 2 years actually are when we cover all the theory, the preclinical theory behind medicine. So it's even squished even more into just those 2 years. And then the third year, we kind of take a break out the medicine degree to just do a 1 year intercalated, which was just sort of like added on degree in medical sciences. So that involves a research project, involves sort of like a coursework sort of thing, and exams. So how do you feel, Ayman, about squishing all that work into all the preclinical medicine theory into 2 years? Was it really busy for you in those 2 years?
It definitely is really busy, and it is a lot, but it's really interesting. I think that's the trade-off. So second year, I'd say, is actually the busiest year, has been so far the busiest year of our degree. And what you find there is you're covering so much content, but it's all really interesting, and that's kind of the constant trade-off you have of the more you kind of want to look at all these subjects, the more in depth you want to go. And they are taught really well. I think a lot of them are taught really well, especially because of tutorials, which are where you have like a small group chat with the tutor about a subject. You'll constantly want to find out more. So even if you have a light week, you end up creating work for yourself sometimes. And whilst there is a lot to cover, I think we do get to cover it all again at some point in clinical school as well, when it becomes scientifically relevant, not scientifically, medically relevant. And part of having it squished into those first years is, of course, that we get that integrated year where you get to choose a couple of topics to really look at in detail. So both Junaid and I think, are doing kind of neuroscience and really looking at that in detail, but you can look at all sorts of different things. So some people look at infection and immunity. Some people look at kind of development and embryology. And it's really nice to know that you have that choice in third year to choose an area you're passionate about and to get to find out more. And because you've done those first 2 years and you've looked at so many topics, you get the chance to think about doing every single topic, so you can really choose the one that's right for you.
Yeah, that's true. That's a good point. That the sort of whistle-stop tour of all of medicine in 2 years does give you a good, at least a little taste of what you might want to do in that third year. And it's good that even though it's technically not part of the actual medicine course, it is good to do it, to sort of have a taste of going deep into a subject and sort of getting quite familiar with and getting your hands dirty with what actually is the line of knowledge that we have at the moment. What don't we know and what do we know? What is that like frontier? That's quite cool to be able to say that you understand. Like it might be a really niche area, that's okay, but you understand like exactly what questions scientists are asking at that point, and that's quite a cool thing to have under your belt by the third year. Of course, any sort of medicine students in touch with the news at the moment might be asking, what are the ramifications of doing an intercalated degree now with decisions being made about the foundation program. But that aside, it is still, I agree, it's still a really sort of rewarding experience. We could move now actually into talking, going in more detail about these busy 2 years that we have. Ayman, could you? And this is also a question that comes up at Open Days all the time. Could you walk us through a typical week in Oxford preclinical medicine in one of those first 2 years?
So a typical week. First, I'll just talk about the academic stuff. Then
it's actually worth mentioning. It's worth mentioning. Well, yes, and it's also worth mentioning that though Ayman and I both obviously do the same course, so we have the same lectures and same practicals, we go to different colleges, which means that the tutorials are offered by colleges rather than by the department, which means that I actually don't know what Ayman's tutorial schedule is like. So that will actually vary. So this is it's important to keep that in mind, and it'd be good to get that variation. So yeah, go for it, Ayman.
Yeah, sure. So I'll start with talking about the department-based teaching. So I think in a typical week, I've just got open one of my second year timetables here to have a look. I typically expect to have probably between 3 and 5 9 a.m. lectures. And often when we have a 9 a.m. lecture, that will immediately be followed by a practical or maybe by a couple of other lectures. And it is quite a busy week in terms of lecture content. And you're talking about maybe 8 lectures, can be between 6 and 10, I'd say. And that really varies depending on how many practicals we have. And then on top of that, you have practicals, you have stats classes as well. And the whole point of that is that we learn kind of techniques for looking at data when we do our research projects in third year. And whilst that's a lot of lectures, a lot of them are kind of introductory to a topic. So before we delve into a lot of detail in a practical class, we have an idea what we're talking about. And I'm not sure if you agree with me, Junaid, but I actually think lectures, having so many, is quite a nice thing because it allows us to spend a lot of time with other medics. Which is really important because we do so much together and we're here for 6 years. So it's nice to get the opportunity to meet other medics. And there's more opportunity in clinical school, but we get that from the start because of these kind of lecture timetables. Of course, now those are online, so that's changed a bit, and maybe they'll stay online. We don't know. But I'm sure that there will be kind of in-person lectures in the future. Then if I think about my own college teaching, we used to have at Christchurch quite a lot of tutorials, and I think they've actually scaled down the numbers a bit now. But in a typical week, I'd expect to have 3 or 4 tutorials, maybe with 2 essays to do and 1 presentation, which is probably where I spent most of my time in first year. In second year, that shifted a bit to kind of spending a couple of hours in the library in the afternoon, maybe, recapping lecture notes. What I thought was nice about our timetable, though, is mornings was very department-heavy contact, and afternoons, you kind of had a bit more free time. And often that did translate into doing work for a tutorial or to having a tutorial. But it meant that there are some afternoons where you could go and play sport, for example, so if you were interested in playing uni sport as well, sometimes there was an opportunity to do it then, or doing orchestras and stuff. There was always more time in the afternoons to have a bit more free time, even meeting with friends and stuff. And then in terms of social life, in a typical week, I probably would have gone out once a week, perhaps on a Thursday night or sometimes on a Friday night. And that was just good because our Friday mornings were always just normally like 1 lecture, so they were a bit easier and a bit more manageable. But there's definitely time, I think, to have a balance between seeing people and seeing friends, and also having proper time to appreciate the content that we're covering. I think I don't know if you agree with me, but I think it's really important to actually have some reflection time on content, because there's so much sometimes being thrown at you in 1 week that you need to just take your own time to digest it a bit more.
Yeah, no, I'd agree. Just to sort of complement that with, we'll give you a sample size of 2 for the listeners. I'm going to go into a first year timetable and have a brief look. Yeah, looking at a random week, we've got what's that? 7 to 8 lectures. That's across the whole week. Then we've got a few practicals, which can be up to 3 hours long, and a stats class also. So yeah, that's sort of roughly what we're talking about. It does get pretty busy. You do because for one thing, you have these hours per week, but you also at Oxford, and this is a thing across all courses at Oxford, terms are 8 weeks long. So that's considerably shorter than most, if not all, other universities. So it's quite jam-packed. We're talking about jam-packing preclinical medicine into 2 years and then again into 8 weeks at a time. So I mean, it can be overwhelming, but at the same time, it's definitely not impossible, like Ayman said, to take the time out to do social stuff, to do things that you want to do. I do distinctly remember in my first year feeling surprised at how much free time I actually had. I don't know if that was because I expected to be super overworked at Oxford. But that's a question that everyone has, that I had, is will I get to Oxford and instantly have no life? Because not only is it Oxford, it's medicine at Oxford. So surely they're just in the library all the time. And there are people who are in the library all the time. That is true, but it's possible. I do think it's possible. I see just within the Trinity medics, we've got people doing, in first 2 years, we had people doing gymnastics, doing rowing, me doing, dance and other stuff. So there are people who find the time to do the things they want to do. But yeah, that time management along the busy schedule is important.
Can I jump in there as well?
Yeah, go for it.
Doing an extracurricular in the first 2 years, or just choosing one thing which you really like, no matter what that is, dance, whatever, music, sport, just having one thing gives you a lot of structure, I found, in the week, and it kind of gives you something to look forward to. So even if you've had, say you've written an essay and it wasn't quite as good as you wanted, or you've had a tutorial where some tutors managed to really get in your head, you have a tutorial where you just felt a bit overwhelmed, you then have something else to look forward to. I should say most tutorials are actually quite fun, I think, but it gives you something to look forward to, and it gives you a week structure. And one of the best pieces of advice, I think, which my college dad or someone in the above doing medicine gave to me at the start, was try and work smart, not hard. And what that meant was kind of when I'm in the library, actually sit down and learn something new or consolidate something rather than just read notes or something, but to do something
Yeah.
productive with my time. And because if you do work one extracurricular or something, I think it means that you have to be productive with your time, and that means you get a much more balance. So I think if you're really passionate about something, you will find a way a lot of the time. And sometimes there is one week where you have to skip the thing you want to do, but just holding on to the fact that it's just an 8-week term and like you are constantly getting through it and you're constantly plodding through it is really helpful.
Yeah, I agree. We're talking about working smart rather than harder. I think coming from A level, especially with people wanting to do medicine, who you guys are probably working super hard for A levels. Making sure you know every single thing on the syllabus because you want to score highly. We actually do have a syllabus for first and second year medicine, which is not a usual thing, I think, across degrees at Oxford. But of course, students coming from that A-level culture of being like, I need to know every single syllabus point, hitting, Oxford and seeing this massive syllabus, that can be pretty overwhelming. And people can definitely get it in their head that they need to know every single thing. And there are people who will try to do that. But I don't think I knew every single thing in first or second year, and I still passed it. So, and that's not to say that you can get away with not doing work. That's not what I mean. It's that there just is a lot of stuff. There just is a lot of stuff, and you've got to make sure that you do what you can. You cover the main bits, and yeah, you're not overworking yourself, but you're still like covering the main bases, learning the main points, and doing what you can. You don't need there's a lot of content. There's a lot of content. There's a lot of lectures, a lot of practicals, but you don't need to fully 100% understand every single thing because you've got that time. You've got that time in the future to go over that stuff. Even when we'll get to talking about exams in a bit, but they're not looking for you to know every single thing yet because, you're just, you're 19, 20, like you're not going to know everything about medicine yet. But still the course does push you to know as much as you can. So it's about like keeping that in mind, but still like working hard, but not pushing yourself, not overworking yourself. That's the sort of balance you have to strike. Ayman, anything to add on that?
No, I just completely agree with you. I think it's just
Yeah.
finding the balance. And whilst we're talking about exams in a bit, like you do have your first year, like your official exams happen at the very end of the last term. And that means you've had your entire year to figure out how you work, what your style is. And for a lot of people, that changes between what you do at school and what you actually are going to do at uni. And I think that having so much time in first year to figure out your exact style of learning and having like practice sets of exams, which we call collections and formatives beforehand, really helps everyone find their own way of working. And there's always lots of support available. Your tutors at your college. I mean, I've not spoken to anyone who hasn't found kind of their tutors at their college helpful. And you've always got people in the year above. And hopefully even just friends and you might have a friend who's really good at neuro, for example, and you can go and talk to them and say, like, could you just help me with understanding this topic? And I find that there is really, amongst the medical students at least, like a very good culture of kind of helping each other out. Which hopefully, it seems to have existed so far, so hopefully continues happening. And that just helps everyone get through a bit more easily, I think.
Yeah, that's true. Like across, we have the MedSoc, I guess Medical Student Society, that is. I don't know, how many students necessarily rely on that in terms of support, but it is there. It's there for students who want to, and at least it's a group of students who are doing the same thing as you, who you can talk to about what you're doing. And Ayman mentioned earlier, in colleges we have sort of support networks of students who do the same subject, or at least like who will be paired with someone who does the same subject, college families. So having a college parent to sort of guide you as to what's the best way to tackle things, or even lecture notes and stuff like that you might need just to help consolidate stuff is good. And that, I'd agree. I think obviously we're just two students, we can't comment for every single student's experience of the community, but as far as I can say, there's a sort of camaraderie of students in medicine. I think because we all just recognize that there's a lot of content, and it's good. It's a good culture. I think I had my sort of doubts about whether it would be a super like ultra competitive culture. And again, you're going to find people who are like that. You just will in the world, right? But but no, it's not a sort of pervasive thing. It's not like everyone's out to get each other. It's absolutely not like that. Like, people do care. People will, share around notes, share around question banks and stuff like that. So yeah, there are levels of support. And I also didn't mention actually how many tutorials I had. I just realized talking about the typical week. I don't know, Ayman, how many did you say you had per week?
I had 3 to 4 probably.
Yeah, no, I'd say same. Yeah, it's the same. Same with me. Yeah, and that'll usually include like writing an essay. For most of those, maybe like 3 out of 4 of those will involve an essay being written. So actually, I guess that's a good, unless you have anything else to add, Ayman, that's probably a good segue onto, okay, yeah, go for it. Yeah.
I really want to say that with what happens a lot of the time is I think that tutors at the start of term have their own research and their own kind of grants to get sorted out. And a lot of the time they actually kind of shift your tutorials towards the back of the term. So it averages out at maybe 3 or 4 a week. But I often find that my 7th or my 8th week will actually be super, super busy, which is nice in a way because you come at the start of term and it's a bit more relaxed. And then it's just before you're going to go home. It's like that mad rush of adrenaline which gets you through the last couple of weeks, which whilst it's not ideal, it just does end up happening most of the time. And I think, I don't know if it was the same for you, but I definitely found my kind of end of terms were a lot busier than my start of term. I think that was, I mean, not in terms of departmental teaching. I think departmental teaching is very good at being consistent, but definitely in terms of tutorials, there was that very kind of back end loaded thing. I don't know, that's probably not the same at every college, but I think teachers are busy as well.
Yeah, I don't think that was I'm trying to remember, but I don't remember that being the case with me. But having said that, that's a good point to make nonetheless, that because the tutorial system is college based, there's going to be huge variation in terms of even down to what tutors cover what, because tutorials can't cover everything in the course. That's the point. That's why you have lectures. So you don't end up having a tutorial on everything because there just isn't the time to. So tutors will sort of choose what they want to cover, choose when they cover it. So going back to my point, it'll be, that'll be quite varied in different colleges. But having said that, they're all Oxford colleges, they're all Oxford tutors. Their job is to, cover the tutorials that help students pass the exams. Actually, it might be worth going into what exactly happens in a tutorial, because I think people understand what lectures are and practicals, labs, that sort of thing. But yeah, Ayman, do you want to sort of give us a rundown of what a tutorial will be like?
So a typical first or second year tutorial, and those are quite different to third year tutorials, I think. We'd be given an essay title about a week before normally. Some tutors give them all at the start of term, some tutors give them at the end of one tutorial for the next one. Given an essay title normally, then asked to write an essay, not too long, 6 pages handwritten perhaps, which might sound like a lot now, but I think when you include diagrams and stuff, isn't actually that long. You then need to do research. I'd normally use a couple of books on the topic, try and find the key chapters or key kind of couple of pages, do some research online, put together an essay. And I'd say I would spend realistically between 6 and anywhere up to even 12 hours of work on some essays. That really does, I should say that's like 12 hours of my computer being in the library. That's not necessarily me working for all 12 hours. And that was like really on the longer side. And that was when we got into very like hard neuro content, which needed more thought. You then go to your tutorial, hopefully send your essay off a couple of days before. And then we'd often start with a discussion of the essay that we'd written. So kind of what were the good points, what were the bad points. And one thing they really like us to do is kind of evaluate the evidence behind what we're looking at and behind the topic we're thinking about, and also look at how could it become clinically relevant. So they love experimental evidence for the first thing about evaluation of like what experiments have been done before to show what we're talking is, so show that what we're saying is true, and also clinical relevance. So how is it actually relevant when you become a doctor? And then we'd normally have an in-depth discussion, sometimes on the topic in the essay, sometimes on a related topic which wasn't exactly in the essay. And I think that was so that the tutors could kind of get us to think in kind of a more, it's cliche, but outside the box kind of way, and try and push the way we were thinking. And then we'd always actually start normally with, do you have any questions about what I said, about the work that was set? And the idea is with those essays, normally there's something which could come up in an exam, but you get the opportunity to go into a lot of depth and hopefully find some kind of more unique pieces of knowledge, which is nice in a way. And I think that if you take a subject and you put a spin on it which you're interested in, it can make a subject which might otherwise be mundane really interesting to you.
Yeah.
And that's definitely one of the advantages of it. And you can definitely steer your tutorial in a direction. I'll quickly talk about third year tutorials as well, because they're very different. We actually book those for medicine through a central system. And you can only choose, I think, what is it, like 8 right now across the course of a year through this system. You can have other ones in your college separately, but eight through the system. And those are you do a lot more work for them because there are 8 through a whole year. And there we'd look at a lot of research papers. We actually had one together last term. And
You did, yeah.
look at a lot of research papers, and we'd really try and think deeply about, was this a good piece of research for someone to do into this topic? Why was it good? Why was it bad? What else do we need to know about this topic? And those almost take a more, I'd actually say, more philosophical route into the science behind a topic. But yeah, that's kind of my brief whistle-stop tour of the tutorial.
So I think it would probably be good to discuss now, because it links on to tutorials. Like you were saying, tutorials, pretty much the point of it is to prepare you for the exam, in which you do, for first year and second year, write 3 essays per subject. So overall, that's 9 essays. Over the 3 subjects that we have in each of the years. Basically, a lot of essays. Essay-based exams, that's not normal for medicine across the country. It's traditional, yes, but not nowadays. This isn't even like PBL versus traditional. This is most unis, I think, do MCQs. And we do have an MCQ component, multiple choice question component. But we also, we have that to cover sort of the breadth of the subjects, but then we have the essays to cover the depth. That's pretty unique for Oxford or Oxbridge. So, Ayman, what are your thoughts on these essay-based exams? How do you find them?
I didn't like the idea of them very much in first year, and in second year I really did, and that's because I found the topics in second year, I think, a lot more interesting and almost more synoptic. So they were more kind of, what I mean by that is they kind of covered more of a topic. So it might ask about pain transmission, for example, in neuro, and that is like one topic I can talk about. Whereas in first year, it might talk about a specific joint in the shoulder, and I would really struggle to think of a way to write like a 40-minute long essay on just one joint. And you do definitely get taught through the year how to do that. So I think the advantage is you learn these topics in so much detail. The disadvantage is it kind of encouraged you to focus on only a few topics. And it definitely, so because of coronavirus this year, we actually only had, for our second year exams, we only had MCQs. And it completely changed the way that I had to revise. I think that everyone had to revise for them. Because in first year, I think most of my friends, the MCQ revision was like a second thought. And the idea was that if you've covered the essays, hopefully you'll have covered enough of the stuff coming up in MCQs. So yeah, I think that people grow to like them, and it's just because the topics become more interesting. But they are hard to adjust to. But everyone is in the same boat in that respect. I don't think anyone came in thinking, "Oh, this is like great. I get to write 9 essays in the space of 3 days." But you definitely get taught how to write them. And also, what I should say is that those are pass-fail exams. Those aren't pass-fail. MCQs are pass-fail, but the essays you kind of get graded, and to get a pass in your essays, you essentially just need to hit the key syllabus points. So it's not actually as difficult to pass the essay exams as I think people go into them thinking it is. And a lot of people, I think, perform better than they might have expected in the essay exams. I went into them feeling really nervous in first year and actually quite worried for a while until we got the results. But then it was like, actually, I had passed them and that was okay. And you do get a second shot at those exams if the first time around doesn't go very well. And whilst that's not ideal, if it does happen, you then have the summer to kind of look at these topics with nothing else to do. Obviously your summer plans, but nothing else kind of academic to do other than focus on the topics which you really need to spend some more time on. Yeah. So I don't know, what are your thoughts?
Yeah, no, I agree. I think I definitely spent most of first year being, because like you're saying, Ayman, 6 to 12 hours, maybe 6 to 10 hours. That I agree. That's the amount of time I had spent on a tutorial essay. So I spent most of the first year thinking, gosh, how am I going to get into a exam and just spit that out in 3 times in what is it? 3 hours or whatever.
Yeah, 3 hours.
2 hours. Yeah, exactly. Yeah. But and to be honest, even now, I still go, yeah, how do we do that? But we do, is sort of the answer. It's difficult if you, it seems really impossible if you set your goal as getting like the highest mark ever. which still, people work hard and people do, not saying that you won't be one of those people. But yeah, like Ayman was saying, to actually get the key points down, it's not that hard. I think most students at Oxford probably stress themselves out with getting the extra points because they want to score highly, which of course is fair. I mean, I exactly fall into that camp. But students do it. Students get through it. Generations of students have done it before, and they will do, because Oxford does like its traditional system. So it's not impossible. It's not impossible. And I think going back to actually a very important point that you made, Ayman, that the disadvantage being that it kind of pushes students to like you're not going to try and memorize or have an idea of an essay plan for every single essay, because that's just sort of like not really cost effective, which does therefore mean you focus on certain topics that you want to write about, which obviously comes with the drawback that you might be focusing more on some bits of the syllabus and not on other bits, as long as you know everything for the MCQ. And then you might ask, like, what is that really good? Is it good that students are sort of focusing on some bits in detail? But hopefully that's where the MCQs come in, to make sure that everyone has at least a sort of baseline understanding. And on that point, I think it's actually quite good that students get to focus on something in depth, because it gives us a taste of what actual science is like. Because medicine, the practice of medicine is based on medical research. It's based on literature, which are essentially essays. So being able to read a paper, being able to add that experimental evidence, like Ayman was saying, which is something that's practiced more in the third year, of course, but being able to sort of critically analyze evidence and have a sort of style in terms of your writing, whether or not you go on to do research, I think is actually a really useful skill. And I am pretty grateful, to be honest, that, or rather, it's one of the reasons why I chose Oxford. The reason that we get to do that, so that I feel like, I mean, I don't know if when I become a doctor eventually I want to, like, how much time I'll spend doing research, but still having at least that familiarity with research and being able to read a paper and not feel entirely like scared by what's going on, or being able to analyze it. Again, I can't say that I know exactly how much primary evidence is discussed at other unis, so do not quote me on that. But I can say that our course does sort of train you to get familiar with papers and get familiar with scientific writing. And yeah, I think that's really valuable.
And the point of an essay, I suppose, is that you're doing a discussion of a topic. And I think it is quite a nice life skill, full stop, to have, to be able to just discuss a topic which you're passionate about in a lot of depth, beyond the kind of factual based. And I'm not saying not doing essays doesn't allow that, but doing essays forces you to practice that skill. And it's like in third year, for example, we get the opportunity to choose like supplementary subjects, which are kind of an extra module. And one of the ones offered to medical students, which not everyone, but a few people do choose, is history and philosophy of science. We are doing more discussion and more essays. And it's nice, having done essays, at least, even if it's not the same type of essay, having done some essays for the previous 2 years, because it gears you up a bit better to what you need to write in finals. And just going from MCQs in years 1 and 2 to writing our finals, and I should say finals, I mean third year finals, which are for our intercalated degree. Just writing essays straight away in those would be kind of a shock, I think, if we hadn't done it in first and second year.
Yeah, that's true. Yeah.
So that's like one of the advantages to doing it. And it does stop, I'm not certain, but I think in clinical school we don't write essay exams.
I don't think so. But
that,
yeah.
I would need to check that, but
it's
less essay based, I think. And
Yeah.
your ultimate exams are obviously not essays for when we go on to become a doctor.
Yeah, of course.
So it does stop long before then.
Yeah. So that was sort of a quick, hopefully not too much of an information overload, but a whistle-stop tour of the medicine course at Oxford, basically, and our opinions on it. And we'll now go to discuss in the last, however many minutes, some of the questions that you guys sent in. So I put on our Instagram for the first time, actually, that I've done this. So that's pretty exciting. So you guys listening, you get to be part of the first time I've done this. I feel like a real influencer doing this. Putting up a question bubble thing on Instagram saying, send us in your questions. One of these questions was about whether we feel like we're missing out on clinical stuff, which we did talk about earlier, but we got 3 other questions, which are actually, fairly deep, but hopefully we'll try and keep them brief because we've already discussed a lot. And in some ways we'll already have covered them slightly. So yeah, we'll go into those now. The first one is about interviews. which is quite relevant because I think interviews are happening now or maybe have just happened in the last few days. How did you feel after your interview, and did you feel like you did badly? Ayman?
I had a mixed bag of interviews, so I enjoyed all of them, no matter whether I felt they went well or not. I enjoyed all of them, and it was really nice. And it's kind of cliche again, but it's really nice to get the opportunity to just talk to someone who's really interesting in a certain field about their field, even if it's just for 10 minutes.
Yeah.
Like I think a lot, and this is something which other people I've talked to shared. Like there's a sense of satisfaction after you've done your interview, whether you think it's gone well or not, because you think about really interesting problems in them. Some of them I did feel went well, and I came out and I was like, yeah, I'm actually quite pleased with the answers I gave there. Like nothing revolutionary, but I answered the questions, I answered them, I think, right. One or two of them, there was one, for example, where I gave an answer and he said, hey, the interviewer said, okay, can you suggest another mechanism for that? Can you suggest another mechanism? And he said this 5 or 6 times. And naturally I felt really flustered afterwards, but I was just kind of like, I've done what I can do. And one advantage I will say actually is that your BMAT score beforehand. And this is like a very real thing. If you've had a high BMAT score, you will probably feel more relaxed because they do take it into account. And this is on Oxford's admissions website. You can actually check out this exact data, how they use it. But they do still use your BMAT score a bit after interview. So that might help relax you, or unfortunately might make you feel. What you should remember though is if you have an interview, you're definitely a candidate who could get in. They would never interview anyone they felt didn't get in.
Yes.
And so what was I going to say? And there was another one, for example, one of my interviews at Christchurch where I'm now studying, and with like my lead tutor, they showed me an MRI and they said, what's that? And it was MRI of the brain. And I said, I think it's air. And I felt so stupid. And they were like, is there air in your skull then? I was like, well, now I kind of feel like there is. I didn't say that obviously, but basically you can have horrific experiences and still get in. So I wouldn't worry at all. And if you've got an interview, it's because they think that you are a candidate that they could have there. And they're interested in seeing, can they teach you? And part of teaching someone isn't expecting they get everything right.
Definitely.
It's expecting that they can adapt and use what the interviewer says in order to kind of get better, in order to think about a subject more. And that's what they're really interested in seeing. So just treat it essentially as like a tutorial, I suppose. And there are loads of mock interviews online. And if you come to an open day when they are eventually allowed again, they do mock interviews at the open days. I think sometimes individual colleges do them, but the medical centre definitely did.
Yeah, it does,
And I assume that they will restart those again when they're allowed. So definitely have a look at some online. Well worth doing, and quite an easy way to get a taste.
Yeah, I fully agree with everything. The only thing, I just reiterate the point really. Yeah, it's not about getting everything right. In fact, it shouldn't be, because your tutors will want to, I say your tutors, the interviewers who will, possibly be your tutors, if you were to get into that college, will push you into a place where you don't know what you're talking about. That's the whole point. Like if you didn't feel like that, then, well, I mean, I don't know what to say. If you didn't feel like that, maybe you were just really good at the subject. But so don't quote me on that. But it would make sense, right? It makes sense to be in a position where you don't know what you're doing, because only then can you actually test someone's ability to think rather than just, reel off facts that they've learned in biology A level. And that's the point. But honestly, like I've known people who it felt like it went really badly but got in, people who felt like it really went well and got in. I had an interview which I thought went really badly, one of them, and then another one that went well. So it's a whole mixed bag, and it's not like if you feel like you did badly, you're not going to get in. And it's not like if you get something wrong or say something really silly or something that you think is stupid in the interview, it's not the case that you're just instantly like disqualified. It's more about how you think, and to be honest, you won't be able to see that as well as the tutors will. So it's difficult to evaluate yourself in that sense.
One thing I'd add there is that they can push you into a kind of an area because they will ask normally about the areas of their own interest, and these tutors are the interviewers are often world leading experts in that field. And it's a bit like if you were to ask a 3-year-old about A-level biology, you can easily push them into an area where they simply could not understand it.
Yeah, that's true. Yeah,
and the tutors will do that to you, and not because they're being mean, but because they just want to see how, and they want to see how you can think. And if it's clear that you're familiar with the subject, they'll just ask you harder questions because they still want to see how you can think. They're not interested in what you know, although you should definitely like try and have a good knowledge of your A-level biology you covered so far, and some A-level chemistry, for example. But it's not what you know, it's like, how do you think?
Exactly.
How can you like manipulate information, I suppose. And also thinking out loud is really important.
Yeah.
To like try and say what you're thinking, because they can't help someone, a student who's not going to say what they're thinking. Whereas if you're kind of explaining your reasoning in a problem, they can point out where you might be going wrong, and they can help direct you onto the right path.
Yeah.
And that's also why if they're correcting you, that's not a bad thing. It means that they're teaching you. So that could be like quite a good thing.
Yeah, exactly. So the next question. This again has the potential to become quite a deep question, but I will try and answer it briefly. How do you cope with your daily stress and work? Ayman?
I think just having a rough timetable of managing my week. I actually I got really busy towards the end of first year, and I actually had like a half hour by half hour timetable on Google Sheets. That might sound excessive.
Half hour by half hour. Wow.
Yeah, that was more because of the way that timing slots worked out. But
Okay, yeah.
that really helped me be like, okay, I'll be in the library in these hours doing that essay, right? I know, and I could like visually see my week. So essentially, find your coping strategy is what I'd say. And you have like 2.5 terms essentially before exams in first year to do that. And I'm not saying it only matters that you cope during exams, but that is when life will get the toughest, I think, within first year. And also just having fun things to do. Like I tried to make sure I did something like very social, like go out, like say once a week, just so I could make sure that I would see friends and also see friends from other colleges, because it's really nice to see your friends in college, but because you see, I think, them so often, like they see you when you're feeling very low and you need to like mix up who you're seeing if you can too. And one of the nice things about medicine is that happens very naturally, I think. But yeah, so find time to like relax with people in college, relax with people out of college, find something you're passionate about, which isn't medicine as well. And I think everyone has something there. Like if you like whatever that is, maybe it's film. There are film societies and stuff. Just kind of find your area of passion and like turn that into and during that half hour, during that hour, block out the medical stuff. So make sure that you meet a deadline just before you finish that, so you're not there sat worried about your essay. So just essentially find your coping strategy, and I think for most people that is spend some time doing something you enjoy, whether that's being social, whether that's curling up with a book, whether that's going to a society. Just find your thing.
Yeah, second everything said there. I will also add, actually, for me, it was easier to deal with stress and work during term when you've got all your friends there, you've got societies and stuff to do. At least you have to you probably go into a dining hall to eat, so at least that's that, like you've got that break. If you're not taking breaks otherwise. But what I found mostly in first and second year was that the holidays, or as we call them, the VAC, short for vacation, that gets quite stressful, because that's when, because they're quite long, 6 weeks, right? So because the terms are short, that's when generally you have to revise the content from the term that you've just had in preparation for exams eventually. But also for those mock exams, or college mock exams, also called collections, at the start of the next term. So that's when I would actually get the most stressed. And it's tough because there's a lot of content to cover. But even when you're at home, you've just got to remember to break up your day, to take time away from doing medicine. You might think it's productive to just keep working all the time, but it literally just isn't, like, psychologically productive. It is hard. I'm not gonna lie that it's easy to keep away from daily stress and work. Even now, like right now, I'm trying to do some research work, catching up from work in the term. Thinking about the eventual deadlines for third year, and I'm not going to say it's not stressful at all. But yeah, it's even though it's hard, medicine is just like that, right? So you've got to remember that you've just got to cope with it the best you can in terms of like taking breaks out. I guess the question is, how do I cope? And yeah, I try to break up my day, like Ayman was saying, make sure I take time away from it to relax and not feel guilty about that. That's the key thing, because it's actually productive to take breaks.
And also acknowledge, I think, that stress is real and that it's okay to feel stressed, because
100%,
like I think everyone in our year, almost everyone who's especially studying medicine, will say that they felt stressed at some point in the course. And that is a completely normal feeling to have. And I think just knowing that that's normal is fine. Like it's not worrying to feel stressed like that. It just does happen. And like stress happens for a good reason. Like you need to know that you have a deadline to meet. You need to know that you have certain things to do. And one thing I'd say as well is like with that, communicate. So your tutors aren't just there in a tutoring role; they're also there in a pastoral role to you. And sometimes communicating is as simple as saying, "Can we just have a 2-day extension for this essay?" And we had to ask that a couple of times in first year, and it helped so much when it was needed.
Yeah.
And sometimes that is being like, "Can I come and have a conversation with you because I'm finding everything a bit much right now?" And then like they might be able to sit down with you and give you some really useful advice. Just talking about it with someone can help as well. So communication, I think. I mean, again, cliche, but communication is key. It's like really, really true. Especially when you're in Oxford is a high stress environment. But I think that is expected given the workload and given kind of the level of depth you're going into topics on. So I almost don't like shy away from that, I suppose. Easier said than done, but knowing that that's the reality, I think helps a lot and helps people deal with that.
Yeah, definitely. Second the point about going to tutors. Like, I think a lot of people outside of Oxford, or at least prospective students, have this idea that Oxford tutors, expect like robots to, just be churning out like, productivity all the time. That's not true. They are people. I promise you, they are people. And even if there's one tutor that you don't, vibe with in that sort of way, you wouldn't really feel comfortable with. Of course, that's normal. But there will be other tutors, and if there's not other tutors at your college, there'll be someone in the department. There'll be a lecturer. And if not, there's we actually do have like welfare provision in the medical school itself, and of course people in MedSoc you can talk to. That there are people you can talk to, and at least someone will know someone who you can talk to, right? So you don't have to feel like these people are expecting you to work yourself to the bone. That's not the case, and also it's okay to say that things are getting too busy, because that, like, it's not just you. Everyone feels like that. And there's only so much a person can do, right? There's only so much someone can actually work. Good. So moving on to the last question now, to tie up this episode that has actually become quite long, but I think it's been good. We've covered a lot of good stuff, and I hope anyone listening has found it useful. Last question now to tie this up, and I think it's a good one to end on. Another one that you guys sent in. How is Oxford different to other medical schools? Which I guess is a similar question to why did we choose Oxford in the first place? And I guess also, after getting in, what are our thoughts about how Oxford differs to the rest of medical education? So, Ayman, your opinion?
Yeah, so I think there's the kind of obvious things about this traditional course. You have this preclinical clinical split. We have tutorials. I think that's a massive one. And there are tutorials at other universities, but I think the consistency and the depth which we have them, and the fact that you have like 6 tutorials over one term with the same tutor, so you have this kind of developing relationship with them, those are all really amazing. There's so many opportunities to do research as well, which again do exist at other medical schools, but they are like, you have to do a research project as part of your Oxford degree. And like sometimes having to do something is the best way to actually make sure you get around to doing it.
Yeah.
But then I think it's not just about what is it as a medical. It's also like it's a very magical place, I think, as a city to be in, and it's it is as a university. I think that's part of the reason why I liked it as well. And there are definitely probably some students here doing medicine who realised they liked Oxford before they realised they wanted to study medicine. I mean, that wasn't the case for me. I decided medicine before I looked at universities, but it is a very like special city to be in, and the magic. I don't know. I think probably because of coronavirus, so we weren't there for so long, but that hasn't gone off yet. The collegiate system is also, I think, quite a special thing to be to experience and to be a part of. And is it somewhat outdated? Probably. Is it very traditional? And are there some weird traditions? Yes, definitely. But it's still a really nice thing, I think, to be a part of. And also, I had one more thing I was going to say, which I've completely forgotten.
I could jump in and then go for it. Yeah.
Also that because of that collegiate system, you get to spend so much time with people not doing your subject, and I actually think that's a really nice thing to be able to have. in medical school. And whilst I have a lot of friends who are medics, especially for the first 3 years because you're in college, a lot of your closest friends won't be medics. And it's really nice to kind of finish your day at the medical centre or finish your morning at the medical centre and then go for lunch with like someone studying computer science and philosophy and someone else studying like modern languages and classics. And that's just like something nice, which I think you don't get the same as much opportunity perhaps.
Yeah, it
some
varies.
other medical schools. Yeah, it definitely varies.
Yeah, that's true. It's like it's so good to not have to always talk about the knee joint if that's the essay of the week. Yeah, I'd agree. Again, I agree with pretty much everything Ayman said there. The only thing I would, my answer to this question, I guess, how is Oxford different, would if I had to like just name one thing about the medicine specifically, aside from Oxford as a place, would just be the grounding in science and primary literature. And when I say primary literature, I mean the actual papers that people write after doing original research and experiments. I think that's something that is really like hammered into you. That's quite aggressive. Really sort of presented to you, let's say, in lectures. They'll show you points about human physiology, and they'll have the citation where this paper is from or where this is reviewed in a journal, say. And I wouldn't say I did this much in first year, but from second year, you're reading these papers. You're reading literally what these researchers have written. The people doing the lectures are those conducting research a lot of the time in world leading research in their fields, in their research groups. The third year gives you the sort of the, because it's compulsory, everyone has a chance to do a research project with, you can sort of just email just email a lab group in Oxford. And there you go, you're doing research at Oxford, like that's what you're doing in your third year. And all of that, and that's sort of like the drive to, the sort of push to like analyze and evaluate, not just take something as fact, but go like, okay, is that a good way of measuring that sort of thing? That thinking really comes across strongly. Like that it's not really there in first year, but it's sort of like, or it's kind of like quietly there, and then it sort of builds in second year, and third year is like all about that. And I think that's something that I didn't think about so much when I was applying, but it's something that I now really appreciate, because I think that's like, even now, like, with coronavirus, seeing things in the news, I think that's even shaped how I see that. It's influenced how
Definitely.
interpret. Yeah, exactly. So like,
it's a life skill, I think, isn't it?
It's a life skill. Yeah, it changes. I like Ayman was mentioning earlier, philosophically, it is a different way of thinking. And I can't say anything about, like what I'm going to be like as a doctor in clinical school, but I do believe that having that grounding of that scientific thinking instilled beforehand, I do think it will be a useful thing going forward. So that's what I'd say is particularly different, and what I enjoy. It might not. I'm not saying that every essay we write is necessarily always pushing that. Like writing an essay about the hip joint. I mean, I don't know whether that's I'm not here to defend every single essay, and there'll be things that other medical schools do better for sure. But at least in this idea of scientific thinking, yeah, I'm a big fan.
Yeah, definitely agree with all of that.
Cool. So I think that's all we have time for today. It's been a long episode, but I hope that it's been useful. I've really enjoyed it. Thank you very much, Ayman, for being on the show.
Thank you very much for having me. It's been really nice to talk about.
Yeah, very, very happy to have you, and finally do this long-awaited episode talking about medicine. I hope anyone listening or watching, thinking of applying to medicine, has found it useful. And thank you for supporting the show. Thank you for following us. If you're not following us yet, do remember to follow us on Instagram at Oxford from the Inside and Twitter at Ofty Podcast. I hope everyone listening and watching stays safe and well. And until next time, bye. We give them a wave.